Oh no, the Washington, D.C. blob is in a panic. We better take a look at this. Hello, everyone. I am Dr. Chris Martinson of Peak Prosperity. And why do I say doctor? Because in this case, it kind of applies. My background, I have a PhD in pathology from Duke University, went through the first 2 years of medical school with all the people who became doctors. And then I took my other 2 years of that program and went into the lab and understood things about how science works. So maybe you've seen my COVID coverage. Since then, I've been talking about all kinds of things because everything connects to everything else. And I'm a systems guy. I like to see how things connect. Today, we're going to connect a few dots. And this has turned into something of a psychodrama. RFK Jr.'s nomination to the Secretary for HHS role. This has triggered the baddies, okay? And here's the announcement from Donald Trump. He's thrilled to announce that RFK Jr. is the United States Secretary of Health and Human Services. Donald rightly says, for too long, Americans have been crushed by the industrial food complex and drug companies who have engaged in deception and misinformation and disinformation when it comes to public health. The safety and health of all Americans is the most important role of any administration, and HHS will play a big role in helping to ensure everybody will be protected from harmful chemicals, et cetera, et cetera. By the way, Evie and I had a chance to have a lunch with RFK about a year before the election, and it was just a wonderful time. And I'm just throwing that in there because, hey, if you got a pick like that, use it now or never. Here's what's happening. CNN is absolutely freaking out. These are the baddies. And by the way, CNN completely dropped the ball. During COVID, they put out really bad information, and including this guy right here, both of them actually, the anchor and also their doctor. I'm going to put air quotes because doctors are supposed to be people who provide useful information and guidance to help you get better. This guy doesn't qualify. Let's listen in. This is pretty bad.
To steer clear of politics, but this really isn't about politics because this is somebody who has been, Robert F. Kennedy Jr., who has been pushing quackery, who has been pushing lies, who has been pushing conspiracy theories. You've been talking to experts in the health community, the medical community, preparing for him, RFK Jr., to be given some sort of role in health. What have they said to you?
Well, you know, it's not often that the entire medical and public health community is going to be in lockstep on something, but they're pretty close on this in terms of their significant concerns, horror even. Somebody said to me today, I can't think of any single individual who'd be more damaging to public health than RFK. Keep in mind, I think if the reporting...
We don't have to listen to more. The horror, quackery, lies, conspiracy theories. Can't think of anybody who could possibly be more damaging to public health. Well, obviously, these people have it exactly backwards. Obviously, CNN is facing, for good reason, steadily declining viewership. The loss of trust has been extraordinary. And then this doctor guy here, who kind of represents the exact reason why I've lost complete faith, nearly complete faith in the entire medical industrial complex profession. But you know what they're doing? They're really scared because they're trying to gatekeep a couple of things. First, they don't want the gravy train to end, and they make a lot of money when you are sick. So, and their advertisers are all about that because pharma advertises with them, hospital systems, healthcare insurers, all of that stuff, right? So I get it. Their bread is buttered on the side of you being sick. That's one thing. But the second thing is, if they actually had to square up to the fact that their side has not just been kind of wrong, but has been responsible for unleashing the greatest medical catastrophe and health catastrophe on any nation in history, at least if you go by the numbers, then they might have a dark night of the soul. They might have to look at themselves and say, wow, I had this all wrong. And that's what RFK Jr. is exposing, is just how wrong these people have been. He's just speaking the truth. Okay. So, hey, if you guys have been doing such a great job there, CNN doctor guy, can you explain this chart to me here? This is showing all the major countries' life expectancy up the y-axis against health expenditure per capita. Not only does the United States, with my laser point, not only do we have the lowest life expectancy, but we spend the most to get the worst outcomes. This is a disaster in one chart. There it is. We are the sickest and the most racketeered because this is a medical industrial racket. It's there to harvest money from us, and it does a better job at that when we're sick. That has been the system. This one chart, if you could just look at one chart and really understand it, this one chart would say, Houston, we have some bad people in charge, and that's who's been in charge. Make no question about it. If RFK Jr. just came in and slept for 4 years, he couldn't possibly do worse than this. How do you do worse than this? Unless he had, mailed arsenic pills to everybody and told them to start taking them, you can't do worse than this. It's that simple, and we're going to go into some of that and why. So, by the way, as soon as RFK Jr. was announced, we saw all the big farmies there, Pfizer, Moderna, Merck, getting tanked. And by the way, Moderna, last I checked, was down 7%. I had to pull this image just before going into the recording studio here. Oh, that's a shame. By the way, how low could Moderna go from its high of $384 to its current 90% reduction? As they say in the financial space, I think it has strong support at zero. This thing could easily go to zero because it's a useless, worthless company with a not worthless, dangerous product. Okay. Now, they're still not getting it. Let's continue to listen in here. This is also on CNN. They're just not getting it. They are not understanding that something big just happened and that we had a sea change and people voted against status quo BS and we voted for the opposite of that. We want truth. We want common sense. We want things to make sense again. And we want to be able to point out when they don't. Let's listen in.
If we're being intellectually honest, there's really no good reason why Bobby Kennedy, RFK Jr., should be HHS secretary. An advisor, a confidant, somebody who talks to the president and advises, but there's no managerial experience in his resume. There's nothing that says he is qualified to do this job that is in charge of the health of all of us, all these different lanes. If he has views and has insights around food sources, around vaccines, then those should be given in advisory roles.
Why?
Well, because...
Well, what were the qualifications of the previous ones?
Well, I think it's important to always remember that you put yourself... Say that again?
What were the management qualifications? I mean, Xavier Becerra...
I'm not talking about the previous. I'm looking forward.
But you're calling into question whether he could actually do this job. And I think it's...
Absolutely. I think America is now, and I think
it's important to discuss it because Xavier Becerra was just a lawyer and a politician with no management experience.
So does two negatives, two wrongs make a right?
Sylvia Burwell was a Walmart lobbyist. Donna Shalala was a university person. Look,
RFK Jr. is a nut.
Okay, so that's different than what you just said. You just said he doesn't possess the requisite managerial experience, but then we get to the real issue here, which is you want to insult the man, which is your right to do because you opposed him in the election. But you, Doctor, are raising the issues that he has been raising, and I think they're appropriate questions to raise. I don't know whether he can be confirmed or not. The vaccine stuff at the table is obviously going to be the flashpoint of this hearing. But I'll tell you one thing. This whole issue of the CDC and these public health agencies, look, public trust in the health regime in this country is as low as it's ever been.
But why?
Because of COVID.
Right.
Because of school closures. Because of mask mandates. Because this country was... But let me just finish. Because this country was drugged through a bunch of condescending and heavy-handed mandates that all turned out to be garbage, and that's why it's low, and the questions are valid.
And RFK is the answer to all of that.
Yeah,
So they're panicking, but you know what? They're not panicking because they have better science on their side. They're not panicking because they have data and RFK Jr. has bad data. In fact, one of the things you got to love about RFK is that one of the things he does is he will bring forward all of his data and say, here's what we got, and here's what we don't have. And their side, the science, capital, the science trademark, the science people, they don't have any science. They keep claiming. So let's make a declaration right here. Let's a definition. An assessment is something you can assess based on here's some data I'm going to begin to assess, and I'm going to use my expertise to draw across those. An assertion is a data-free claim that I make, right? I could just assert something like, if you watch this program, you will live 5 years longer than other people, right? It's an assertion. I could say that. Doesn't make it true, even if I repeat it over and over and over again. These poor people on CNN, unfortunately, have been in an echo bubble for so long, and things have been asserted so many times. They've falsely elevated them to the same thing as an assessment. Hey, vaccines have already been assessed. Have they? Let's go further and see what we can find here. By the way, how will we ever survive between leadership that we're moving from to? I don't know. I don't know. By the way, all this leads to probably the most important episode I've produced in a very long time. It just kind of gelled and it came out. I'm always searching for the big theory of everything. We have to understand actually who we're up against in this story. And it involves free will, which means this is actually a spiritual battle that we're up against. I wish I could frame it some other way, but this fits the best. This is really explosive. Here's what you get when you come to Peak Prosperity, one of my subscribers. You will get, hey, I'm your information scout. I will find the signal within the signal. I'm going to always put it in context. I'm going to always be thoughtful about it and think about it. I might not get it right. You might disagree, but there will be real thought, not just a regurgitation of something else I found somewhere else. Okay? And then the last thing is I'm going to frame things in a way that will help you make sense of all this and then understand what you can do about it, because we're all going to have to do stuff soon. As Ayn Rand said, fascism and communism, by the way, and we are facing versions of one of those isms there, are not two opposites, but two rival gangs fighting over the same territory based on the collectivist principle that man is the rightless slave of the state. Are you tired of feeling run down, maybe low energy? You know you've got some pounds you'd like to lose. Maybe you've got brain fog or something like that. Listen, we think we have the answer to all of that, and it begins with your food. If you're like me, you were shocked to hear testimony recently that unraveled and unearthed and exposed the idea that our food has been made addictive by addiction specialist scientists, the tobacco scientists out there putting things in our food. Maybe it also shocked you to discover that Europe does not allow all kinds of stuff in our food because they know it's toxic. What is the combined effect of all of this? Listen, we know what the data is. It's horrifying. The number of children showing up with type 2 diabetes, the total metabolic disasters unfolding across the land, marked by obesity, sure, but we have cardiovascular issues, concomitant rises in cancers, all of these things, and it all starts with food. Garbage in, garbage out. So what do we do about that? First, it begins with understanding the context. We've put together a very exciting, comprehensive food webinar that will expose the regulatory side of this and what is being done and why and how this happened to us. We'll be talking with Thomas Massey about that. We've got Dr. Ken Berry talking with us on the practitioner side and the solution side. We've got Tracy Thurman talking to us about the war on farmers and the war on food that has been happening. And Robert Barnes to help us understand that as well. Many, many other guests to both define what the problem is and what we can do about it. And we want to make it as simple as possible. Here's an example. Tortillas. Hey, maybe you're even on keto and these are carb-wise. So these have low amounts of carbs. See that? Carb-wise. Yeah, these are carb-wise, so keto-friendly. I want to note something. You see how fresh these look? Yeah? You see any mold in there? Any bacteria, any yeast, any sign of anything, any organism in there? These things expired in June and it is now November. So, what are they putting in our food that even black mold won't eat it? I don't know, but I've decided that if it's not good enough for black mold, it's no longer good enough for me. Once you start down that path, you realize that we have got sugar and preservatives and salt and seed oils, all of the chemicals that are unnecessary, and the fact that the food pyramid is absolutely wrong. So, if you like effective information that leads to effective action, this webinar is for you. It's going to be the usual thing that my team and I will put on. It'll be organized, digestible, easily understandable, and most importantly, it's going to be actionable in ways that you will understand what to do. And I've designed it so that you would easily be able to send this to anybody that you love or care about, say, can we talk about this, and have it as a starting point for conversation. But what we really want, we want you to be healthy. Because, well, who doesn't want to be healthy? Health is the number one form of personal capital you can have? Of course. But given everything that's going on in the world, being healthy and vigorous and active are going to be dominant strategies and things you're really going to want to be carrying in. So, folks, it's time to get prepared on all levels. It begins here. It starts at home. It begins with our eating. And let's just make sure that we're not eating stuff that even black mold won't touch. With that, thank you very much for listening, and we'll get back to our regular programming now. Bye-bye. This is actually what we're going to watch here, is we're going to see that these people who are saying, RFK Jr. is the worst thing ever. He's very offensive. It's horror. We're facing this with horror. What they're really saying is he might undo decades of careful plotting and planning to turn people, subjects, citizens, subjects, into these automatous slaves of the system. Because that's really what the program has been. And if you don't agree with me, then maybe you can explain the science here. Remember this? Remember scenes like this from COVID, right? Obviously, COVID wasn't all that deadly. They had that data. Obviously, I presented that with the RKI, that's the Robert Koch Institute leaks that came out. That in Germany, they understood that they didn't even have a deadly circulating virus at a level even comparable to prior years with simple flu-like illnesses. And then it's somehow, we always have known that respiratory viruses outside in the sun surfing, not a problem. But here's this poor woman, she's masked up and being harassed by 3 Tyvek-suited goons who are very offended with her being outside. So when they say RFK Jr. is a nut, he doesn't understand science, they really mean he doesn't understand our science, which is the same thing as our democracy. It's a simulacrum. It is a facsimile of that thing that they are describing. Our democracy isn't democracy at all. And our science actually isn't science. I'm going to build that case for you today. Hey, you know what? RFK, he just doesn't get us. He doesn't understand these poor people. He just doesn't. He doesn't understand these people and their science. He just doesn't get them. And that's a shame. Okay? He doesn't understand all these great moments in science. He fundamentally wouldn't understand. Like those people like, how dare you suggest that we lost some faith during COVID? Like, you weren't paying attention then, were you? Okay. But this is now, we got to get to how these people who are anti-vaxxers, we'll call them pro-vaxxers, they're actually a cult. It's a very strongly anti-science religion. Now, here's another definition for you. When you're discussing opinions, when people are making assertions which are based on data, you can have those conversations. They can even get passionate. But they don't immediately default into a rigid emotional state. If you discuss something with somebody, they immediately go from a 0 to like over a 2 on the 1 to 10 emotional scale. They're immediately outraged, upset, angry, bitter, withdrawn. Like if they have some strong amygdala emotional reaction, that means you're in a belief system, not discussing facts or having opinions. So listen up and listen if you can see for any sort of like bias or whether this woman is making what you would claim, what you would credibly call assertions versus assessments. Here she is with some gotcha questions for RFK Jr.
And Mr. Kennedy, one of the biggest controversies surrounding your candidacy is your stance on childhood vaccines. Nearly every scientific and medical organization, including the CDC, the FDA, the AMA, the American Academy of Pediatrics, all say you're wrong on this issue. This leads us to our very first question from our audience. It's Dr. Tariq Butt, who specializes...
I would ask you one thing. On what issue?
On childhood vaccines.
What about them?
And whether they ever cause autism or damage kids. They all say these vaccines have saved millions of lives.
They never damage kids.
I don't think anybody has said they never have. There might be a child here, but overall, all those organizations say vaccines are safe and have saved millions and millions of lives. But let's get to our audience question.
See how she contradicted herself right there? She's like, well, I'm not saying nobody's ever been damaged, but they're safe and have saved millions of lives. So they won't even allow this idea to settle in, which is like, well, how safe are they? What is the actual damage profile? I'm going to show you the data on this, but this is just absolutely astonishing how she sort of frames that. Oh, by the way, appeal to authority. The CDC, the FDA, all these organizations that have these revolving door relationships with the pharma companies who make these vaccines, which, by the way, Congress, in their infinite wisdom, gave them complete product immunity for. Nobody gets product immunity. You can't get, imagine like Congress passes product immunity for you. If anybody comes over to your house and gets injured, you're off the hook. No liability, even if you had a rotten floor you knew about and they fell into your basement. Like, nobody gets product immunity, but pharma companies did. Prima facie evidence right there that there's something wrong with this story, because if you have a safe product, as she's claiming, by definition, you don't need a liability shield. It's like, this is simple logic, unless you're caught in a cult of religious thinking, which I'm going to expose here. But first, let's carry on to this next part, because, oh, by the way, just some data for her. This is one of the most damaging studies I saw, which was just a doctor office combined their records with another office, I believe, and they asked a simple question. They said, hey, we happen to have two cohorts of kids who've come to our practice, some that for whatever reasons were unvaccinated. Parents made the decision, and others that were vaccinated. And then they didn't say, does it cause autism necessarily? They just asked the question, over time. So the x-axis here is going to be over time, how many days, a bunch of days have gone by, and then how many doctor visits did they have? And you can see here that the vaccinated for asthma, vaccinated kids just showed up at the doctor's office way more over time than unvaccinated kids to be treated for asthma. Same is true for allergic rhinitis, right? How about breathing issues? Same story. How about behavioral issues, which we might call autism as part of a behavioral issue if we wanted to look at it that way? ADHD, oh my gosh, would you look at this? Would you look at that's just like almost none to this very, very high number. Respiratory infections, that this would speak to a compromised immune system. Otitis media, getting your ears, having to get tubes put in there, and all the penicillin and other antibiotics. If you have kids who've had otitis media, you know what I'm talking about. It's very painful, very upsetting. And by the way, you can see here, clearly vaccinated kids had way more incidence of that over time than unvaccinated kids. Same for ear pain, same for all other infections, same for eye disorders, including conjunctivitis. Again, all of these things sort of collectively pointing to a dysregulation of the immune system. We've got eczema, dermatitis, uricans, and anemia. Ooh, big difference on anemia, which would be reduced blood counts. So as well, remember when they had to give the 1987 Act and they shielded drug manufacturers from liability? It's kind of because they had a batch problem in a DTaP vaccine. This is pretty dark. I've presented this before, but this is actually an internal correspondence. This is from Wyeth, and they're talking about their DTP vaccine. This is in 1979, and they said, after the reporting of the sudden infant death cases in Tennessee, we discussed the merits of limiting distribution of a large number of vials from a single lot to a single state, county, or city health department, and obtained agreement from the senior management staff to proceed with such a plan. If you make a bad batch and it kills a bunch of babies in their cribs, solution. Not fix your manufacturing process or run proper safety studies. Just take individual batches and spread them out. Because that way, if it's a dead baby in Seattle and another one in Tennessee, I was going to notice maybe. People won't connect the dots. So this is the science that lady is certain about, right? This is history. This is how it is. And by the way, they had to do this because it would have otherwise, I think, cost them something really exceeding terrible, like another penny per dose to produce this stuff if they wanted to do it safely. So now let's just spread the batches out. By the way, since 2009, we have known, the world has known, that when they compared countries that gave less versus more overall vaccine doses, and this only goes to 25, right? Now we're up to 71, that in places with the mean mortality rate up this axis versus vaccine doses, there is a linear straight line relationship. The more doses of vaccines you give, the more infant deaths you have in the crib. Sudden infant death syndrome is tightly P of 0.0009. Case closed. That's where we're at. 2009, you know what we did in the United States about that? Nothing. We just doubled down and went forward with more aggressive anti-vax, anti-programming, right? Just more marketing, turned up the knob to 11 and just came after them with heavy-duty marketing budgets. By the way, everybody, if you were one of those people who worked at one of the companies that was helping with this PR to savage the doctors who are pointing this out and to cover this up, this is on you. This is the kind of person you are. And you and the rest of us need to understand that these people exist. They would look at data like this and go, we should break those batches up and let's see what we can do to trash the people who point these sorts of things out, because this is very inconvenient for our bottom line. We got sick kids with sore ears and behavioral issues and ADHD, whatever. Kids dying in the cribs. Let's just spread the lots out. Let's just trash this study and bury these things. Look, this is settled. This is actual science, right? Now, we could go further than that, but first, let's move on to that question that she said there was an audience question. Let's go.
From Dr. Butts.
Good evening. Eradication of chickenpox and polio from the U.S. and many parts of the world is a direct result of regular vaccines. Measles, mumps, rubella, and many diseases are preventable, and there's little to no evidence of these diseases in vaccinated population. Your vaccine stance is dangerous to the health and well-being of millions. Medical experts are deeply concerned about your message. How can we help you to come to the side of science?
What was the question? How can you help me come to my senses?
No.
No.
Side of science?
You are a very smart person.
Okay, so, I think most people don't know what my stance is on vaccines. I've never been anti-vaccine. And I've said that hundreds and hundreds of times, but it doesn't matter. Because that is a way of silencing me. Using that pejorative to describe me is a way of silencing or marginalizing me. My position on vaccines, I think, virtually every American would agree with my stance on vaccines, which is that vaccines should be tested like other medicines. They should be safety tested. And unfortunately, vaccines are not safety tested. They're not. Of the 72 vaccine doses now mandated, essentially mandated, they're recommended, but they're really mandated.
Listen to this.
For American children, none of them, not one, has ever been subject to a pre-licensing placebo-controlled trial.
Yes, they have.
No.
Yes, they have.
Okay, let me just say something.
Yes, they have. That's an assertion. So this poor lady has been around so many assertions. She's like, yes, they have. You're wrong. Lady, you're talking to a guy who's so deep on this, who can quote literally hundreds of studies just off the top of his head, has been involved with looking at and exploring through thousands of studies. He knows the exact nature of the landscape, but you know more because all your friends agree at your neighborhood, gatherings that this is how the world is. This is not science. It's scientism. This is a religion. This is repeating the catechism of pro-vaccination. And what they don't understand is this was an idea that was inserted, a belief system inserted in them by self-interested companies who don't care about harming people, who just wanted to make some more money. But they're carrying it with as if it's like a religious battle, like they're going into the Crusades. She will defend this. You know why? Because to actually face the fact that all these children have been damaged, that becomes a dark night of the soul for these people. So it becomes too high of a psychological hill to climb. It has nothing to do with the data or the science. RFK Jr., bless his heart, is just out there saying, can we just run the proper studies? Hey, it might turn out that they're completely safe. We don't know. The studies haven't been run. But why have we spent, as a nation, so many decades doing everything possible to not run the studies? Unless we kind of already know that running those studies is going to not show the result we want. Because that's what I've learned about the pharma business. They only run the studies that they know are going to give them the results they want. These studies haven't been run. Ergo, they're not going to give them the results they want. In fact, it could be a lot worse than any of us suspect. So if you are uninterested in getting to the bottom of this, lady, then it's kind of time maybe to ask yourself, are we the baddies? Because the answer is, yeah, you are. You're the baddies. You are. And, oh, hey, Dr. Butt, care to explain this? Oh, yeah, the measles, if it wasn't for vaccines, we would have all these measles cases. This is measles deaths over time. Let me get my laser pointer back out again. And you can see here, it's coming down. You know why? This is because of proper nutrition. This is because of better sanitation. It's because people are finally living in warm, cozy houses and, not going through all kinds of crazy insults on their health because they're undernourished, malnourished, or whatever. And then finally the measles vaccine is introduced here. And this guy, Dr. Butt, perfectly named, is going, oh, yeah, we can clearly, because I'm such a rational human being, I can tell you as a medical professional that we can, the vaccine obviously is responsible for this thing that happened before the vaccine even came around. It's literally, this is not rational, okay? He's not holding a rational point of view. This is why people like me, maybe you, have lost faith in the medical profession, because I need this guy and people like him in this profession to not be religious nut jobs who don't look at data. The whole thing is about looking at data. I wouldn't want our nuclear engineers to insist that the chicken bones were thrown into the scrying pit this morning and were not favorable for moderating the reactor core this afternoon, right? You don't know. It's not how any of this is supposed to work. But he's just repeating an assertion that he got from somebody else, who got from somebody else, who got from somebody else. And RFK is just standing before us saying, can we just get to the bottom of this? And by the way, when you peel it back, there are not any supportive studies to put the word safe in. That might be true, but we can't make that claim. That is an assertion, and it's a data-free assertion. Why not get the data? Now we have to start asking the question, well, listen, if you are not, whatever kind of culture you think you're in, if it's a culture that knowingly or disinterestedly is harming its own children, it is not a culture that is worth preserving. It is defective. It is morally broken. It is a spiritual bankruptcy. That's what that chart is. RFK that whole time has been saying, hey, let's fix this. And he's been fought every step of the way by people who think they're well-meaning, but are clue bags. This lady has zero idea of the depth of her ignorance on this subject. But she's confidently ignorant. It's a bad look, lady. Just letting you know. Okay. And by the way, this is the vaccine schedule now. Like here it is back in 1960, that many. So that would have been sort of what I faced back there. This is what it is now, right? In 2018, and now it's up to 71 in 2024. And this is for Australian children, right? But guess what? Not one of those has been properly tested in isolation, but guess what? Never in combination, right? Be a lot of tests to run. They just haven't been run. So now I want to introduce another concept to you. A good friend of mine who's a retired police sergeant said, hey, he said, Chris, when you go to a domestic violence call, you might think it's pretty clear cut. You show up at the house, the guy's been beating up on the woman, so you take the guy into custody. He said, you learn really quickly after you respond to just a couple of these, you never take your eye off the woman in that story, because as soon as you start arresting the guy, the woman will come at you with something, a rolling pin, a knife, whatever. I mean, it's crazy. This is a person who's been abused, but when the police come to arrest the abuser, all of a sudden their loyalty, they are so attached in through that abuse cycle that they can't think of anything else to do but to attack the people who are attacking their attacker. It's crazy. It doesn't make, well, maybe not crazy. It's human psychology. It's how it is. And I raise that because Van Jones is here. He's scared and he wants to attack the arresting officer who's coming in. So I think that's great framing for this. Let's listen in.
He kind of was going out publicly, contradicting Howard Lutnick and saying, Trump has told me I can get essentially whatever I would like in this administration.
I don't know what you want me to say. I am just at a loss because we're watching something happen in slow motion that is terrifying. You know, the reason we have a great country is because there are pillars in place. There are columns and structures, just like in your house, columns and pillars that you don't see. but they keep things in a good place. They keep things in a good direction. We have healthy children because there are people who've made sure that there are things in place for that. And right now we're seeing termites unleashed on everything. And this is a termite appointment. We know for sure that Bobby Kennedy is a vaccine denier. He's a vaccine denier. He denies being a denier, but he is a denier. And he is going to do great harm. And when you drive down trusted institutions, democracy only works in a high trust environment. When you make everything political, when you make everything negative, when you cast doubts and aspersions, eventually people have to rely on strong men. And so we're in a process right now that's just heartbreaking. And, it turns out that Donald Trump wasn't telling the truth when he said he wasn't.
Anyway, so he's right about the fact that you need to live trust. We have to have trust. We live in a complicated society, and it's really helpful if we can trust. However, Van Jones, when people make assertions and say, oh, these things are totally safe, and then it turns out they're not, it is not antitrust. It is not a denier. If you say, hey, can we get some data with this finally? Why don't we just study these things properly? Because that's how you build actual trust. Trust can mean a lot of different things, but it means repeated, consistent actions, right? Well, right now, my trust in many others is broken because the repeated, consistent actions of the FDA is to let companies like Wyeth just spread the lots around and to cover up studies that show that sudden infant death is correlated with more vaccine doses. It's not ever having a proper controlled trial, not just for the vaccines themselves, but for the adjuvants that are in there to help stimulate a strong immune response. Things like aluminum hydroxide, right? The aluminum in these shots is a very strong culprit. I could have a whole separate episode about that. These things are known. And by the way, the idea that you could go from, that woman said, oh, so sure, a few children might be harmed, right? Sort of flappy her hands at that. Gross, obviously. But why wouldn't we actually have then, say, some sort of a compassionate program to say, yeah, on balance, we really think it's good to have 100 million people vaccinated for something, and we understand that 10,000 are going to get hurt. Well, we're going to take care of them because that is the cost, the public cost of running this. That's this larger program that we believe in. No, if you really believe in something, you pay for it and you pay up. And only a sick culture would say, yeah, the 10,000 people who get harmed at the end of the bell curve, roadkill, collateral damage. The bills are on them. If they lose their house and home, that's fine. If they end up committing suicide in despair, whatever. That's gross. That's who these people represent. So yeah, this is horrifying, Van Jones. I get it. You're terrified. You're terrified. There's termites in your house. The problem is your house is already rotten to the core. So I don't know why people like how is this even an issue? But I'm glad to have these people exposed for who they are. And it's not a pretty sight. But the sooner you and I can get our minds around the actual nature of the people we're up against, they're like, look, my religion, our science, Scientology stuff requires that you don't ask any questions, that we're allowed to harm you whenever we want, that even I'm willing to accept taking some harm in this story because it's more important that we believe in this assertion made by companies that make money. Weird thing. Than it is for us to actually understand stuff and make real progress and do real science. As a scientist, I'm really offended by all this. So again, they like our democracy, which means only when they're winning, and they like our science, which is whatever version of it got implanted in their mind by marketing agencies. It's so weak. It's like I got a little bit of contempt for people who have belief systems installed by self-interested marketing divisions of companies who just want to make money. And then you carry it for them rent-free. Hard to have respect. The reality is, Callie Means right there tagged under this said, Van Jones, hey, actually, we have the sickest kids in the developed world. True. They're being destroyed. It's existential. 38% teenage pre-diabetes rates is a moral stain. Bingo. I know you're a caring person. Let's have a long-form dialogue with Maha, folks. There's real bipartisan opportunity here. How is this a partisan thing? I don't understand. It's not a left-right thing. It's a moral thing. You're either moral or immoral? How do you willingly say, you know what, I just want to take the immoral side of this. You know what, I'm all for sick kids. I'm all for increased autism, and I'm all for gaslighting families who are injured. I don't understand it. I just don't. Okay. But perhaps I think Dostoevsky nailed Van Jones here and other people like him by saying your worst sin is that you have destroyed and betrayed yourself for nothing. You're not going to get any lifetime achievement plaque from Pfizer there, dude, or from Monsanto. Ain't going to happen. Sorry. It's for nothing. So let's talk about that for just a little bit, because one of the things that super offended people was RFK Jr. coming out, and he was asked a question, said, well, what would you do at the FDA? And he said, I would start by just completely eliminating the Department of Nutrition, right? And so I like this meme and how it explains it. So why the Department of Nutrition? Well, because garbage in, garbage out. It turns out that our food is the beginning of it all. And we know this now, and we've known it for a very long time. We feed ourselves toxic garbage in the United States. Don't believe me? Here's a school lunch menu over here. You can see here that Tuesday would be a strawberry Pop-Tart for a kid's breakfast. This is just standard stuff. I could show you 100 just like this. Wednesday, apple cinnamon benefit bars. Thursday would be Pillsbury mini cinnamon caramel rolls. Friday would be Crunch Mania graham snack, right? And toss in the 1% low-fat milk just to sort of round it all out there. But this is absolute toxic garbage, and this is an elementary school breakfast menu. And that's what it would look like. Sure, you put the apples out there and your little 1% milk in the bowls, but the rest of that stuff, the waffles and the Eggos and the Pop-Tarts and all that French toast and all that stuff, this is pure, ultra-processed, high-sugar, nasty-ass garbage. That's what we're doing. Somehow, the experts at the FDA, who will all agree that this is a healthy lunch, came to that conclusion. Nobody comes to that conclusion looking at data, okay? Nobody comes to that conclusion looking at the health trends of the youth and the adults in the United States. That data clearly says, wow, sickest, shortest lifespan of any developed nation, broken system. So the idea that maybe you would just go forward and just get rid of the people who had screwed up so badly that they brought you this as what we're feeding our children. Now remember, eating patterns get established in childhood. Look what they're establishing. It's gross, okay? Here we can compare, hey, look at that ultra-processed, comes in a bag. I'm sure if you read the list of ingredients, there'd be things on there you could not pronounce, okay? And let's compare that with a Japanese lunch. That's what they do in Japan. Or you compare Brazil to the United States. Just how it is. So here's the thing. The people who are defending that school lunch, instead of understanding that we actually care about our children and we care enough to feed them properly and appropriately. As Maya Angelou said, when somebody shows you who they are, believe them the first time. They've shown us who they are. They've thrown down the gauntlet. They are terrified that somebody might come in and say, hey, this is no good, right? Might look at the autism rates in children and say, no bueno, we got to fix that. That is bad. Somebody who might come in and say metabolic disorders and obesity and diabetes in 38% of our teen kids is not okay. If you are terrified by that, if you're horrified by that, if you find yourself offended by that, you are the baddie. Okay? And that's the thing. We've just seen how many people are the baddies. Now, that's not because they're bad people. It's because they've done something really horrifying to me, which is they've coughed up their free will. And they've given it away. And they will fight to the death to not be exposed to anything that might point out that they actually coughed up something, which was the only thing they actually have in this life that's uniquely theirs. And they gave it up for nothing. And that brings back that Dostoevsky quote. At long last, they gave it up for nothing. Literally nothing. And that's why this is what I'm going to be talking about next. So let's skip over there for all the Peak Prosperity subscribers. This is going to be one of the most important episodes I've ever put out, because I think it explains what's actually going on here. And it has nothing to do with data or science. It's a psychodrama. And we have to understand it because we need to know who we're up against. Because if you don't know who you're up against, you will underestimate your enemy. And we can't any longer do that. It's for ourselves. It's for our children. It's for the future. Thank you for listening, everyone. I'll be back next time. Bye for now.